Wow. So what do you think are some of the roadblocks for people to have better bone health? Like what's preventing people these days?
The first one I would say is at the point of diagnosis, at the time they're told, hey, you have osteoporosis or you have osteopenia, the recommendation that's made at that point in time is take some calcium, take some vitamin D, go for a walk, and here's a bone medication. And that is woefully inadequate, right? It's not
Mhm.
enough. There's a lot more to it than that. And what you have to start doing is you have to first understand, are you still actively losing bone right now? Because a single bone density scan is not going to tell you that. You have to start looking at what are called bone turnover markers first. So
Mhm.
there is a test called the CTX, CT-low peptide test, a serum CTX test. And what that test looks at is it looks at the activity level of cells that are breaking down bone. Right, your bones are collagen bone are made of collagen protein. When that bone is broken down, it releases collagen, and that can actually be picked up and measured. Right, so that's what this test is looking at. If that activity level is really high, that can be an indicator of active bone loss. Okay,
Mhm.
and something that has to be addressed. Another test to look at would be the 24-hour urine calcium test, and that's not looking at it's not looking at the activity level of cells that are breaking down bone, but it is looking at calcium, which is the primary mineral constituent of bone. So if you have high levels of calcium in your urine, that could be a contributor also.
Mhm.
But then you also want to look at some of the other parts of that picture. So understand first if you're still actively losing bone. The reason that's a roadblock is because most of the time, most doctors are not going to check that first, right?
Mhm.
And especially if it's like your general practitioner, if they're not familiar with the interpretation of the test, a lot of times that test won't be ordered because it creates a liability, right? So sometimes what they might do is refer you out to an endocrinologist, but even then, you might not get the help that you need in those situations or the information that you need to. That's
Mhm.
kind of the first roadblock I would say is like, are you actively losing bone? Then let's say those results come back and you are still losing bone. There's something contributing to that loss. Yes, hormones play a role, but that's not always the underlying root cause. And a lot of times there could be multiple root cause issues. And a lot of people don't know this, but there are two types of osteoporosis. There's primary osteoporosis. That's related to the decrease in estrogen in postmenopausal women, right? Estrogen has a protective effect on bone. When estrogen levels decrease, as they do during menopause, that's going to cause an increase in the activity level of cells that break down bone. Those are called osteoclasts, and going to cause an increase in those cells. But then there's a whole nother cause of osteoporosis, and that's secondary osteoporosis. And that's when, bone loss and osteoporosis occurs as a result of behaviors, conditions, disorders, diseases, medications, all those kinds of things. That's the category I fell into, right? Celiac disease, malabsorbing nutrients for a long time. But there are a lot of other things that fall into that. And you just have to make sure that you've addressed all those issues. And a lot of times that does require further testing.